Hello, good evening, everyone. I hope everybody's here. Okay, so let's start our topic for today because it's already 7:20 p.m. Okay, but before we start, I just want to introduce myself. My name is Jonathan Amelon. I am a registered emergency first responder instructor by Professional Association of Diving Instructor. Okay, so for no further ado, let's start our topic for today, which is airborne pathogen awareness. Okay, it's a part also of our activity from health education for family. Okay, so for no further ado, let me start my presentation. Okay, introduction. Okay, the purpose of this course is to teach you the basic step, okay, for reducing the risk of airborne pathogen diseases and transmission at a layperson level. Okay, so it's applicable to common settings such as those within at the home or office or businesses. Okay, in particular applies for situation in which the disease possess a significant health threat. Okay, so but a vaccine is not yet available. So there are a significant number of people that are unvaccinated. So who may be exposed. Okay, so this course does not cover the high level requirements or method that are used by medical professionals, okay, especially in interacting with patients who have known or suspected diseases. Then at the end of this course, you should also able to explain what is airborne pathogen, okay, and give a several example of diseases caused by them. Also, list and explain the two primary ways of airborne pathogen pass from infected people to unhealthy ones, okay. So list and explain the four main factors that influence the risk of transmission of airborne pathogen. Explain or demonstrate the two primary method and factor that related to them for reducing airborne transmission risk apart from vaccination. Okay, explain and explain and compare medical mask, okay, and other face covering, okay, and the role of each reducing airborne pathogen transmission. Also explain or demonstrate the two primary method and factor that related to them for reducing contact transmission risk and identify which is the most effective and important. Then also we will we will identify what is contact awareness, okay, and how does it help to reduce the contact transmission risk. Okay, we will explain also how to choose and learn to use appropriate disinfectant based on how they differ. Okay, explain the basic consideration and step for using disinfectant. Okay, explain or demonstrate how to don and remove mask, okay, and gloves. Explain and the recommendation for airborne pathogen for risk reduction when dealing with a medical emergency. Okay, explain where you can find the local information about the airborne pathogen. Okay, so next airborne pathogen diseases. So we will explain what is airborne pathogen and give several example of diseases caused by them. Okay, so again, airborne pathogen is a diseases, okay, causing by a microorganism pass from one person to another several ways. So an airborne pathogen is a disease that transmit from infected people via fluid existing from or entering the respiratory system by inhaling the droplets, mucus, and saliva. Okay, so airborne pathogen includes the specific diseases causing by fungi, bacteria, protozoans, and viruses. Some such as diseases do not have a visible respiratory sign and symptoms. Example range from mild to very serious and include our COVID-19, common colds, SARS, and MERS, measles, influenza or flu. mumps, chickenpox, okay, and whooping cough, diphtheria, okay, and also tuberculosis, also known as consumption anthrax, okay. So now we will identify what is mode of transmission. Okay, so let's look how this disease pass from infected people to other sick people. Okay, so as you can see, the two primary transmission mode, first respiratory transmission, then the second one is contact transmission. Okay, so we will explain the two primary ways of airborne pathogen pass from infected people to healthy one. Okay, so depending upon the diseases, pathogen transfer may from infected people to several ways. Again, airborne pathogen transmit to primary ways. Through other ways may exist some extent depending upon the diseases. Again, first first is excuse me, respiratory transmission. Okay, in the primary mode of many pathogen transmission, it occurs when an infected person inhale and sneeze, cough, and or talk by releasing germ, okay, laden droplets or other particles into air. So, which another person inhale also. So, some pathogen can also be inhaled after becoming infected to find particles, excuse, or dust, then get disturbed into the air. Okay. So experiment have found that infected droplets in the air can float for as long as 3 hours. So remember, again, infected droplets, they can stay in the air or float as long as 3 hours. Okay. So very important, verify fine droplets and throw to remain airborne for many hours. But because they are smaller, so they carry small amount of pathogen. So the role such as fine droplets is fully known. Okay, so some viruses are thought to transmit through particles that become airborne when infected person or vomit. Okay, so the second, a few instances, pathogen have been through to the become airborne due to aerosol or effect following toilet flushing by an infected person with specific diseases. Excuse. Okay, the next one is what we call the contact transmission. It's also called the fomite transmission in healthcare. So, occurs when the germ-laden fluids from an infected person, respiratory system, or other fluids in some cases. So, are deposit on a surface, okay, and an infected person touch the infected surface followed by touching their eyes, okay, their nose, or their mouth. It will transfer germs into the body through mucous membrane or mouth or nose or the conjunctiva membrane, eyes. Okay, so transmission can also occur directly in infected person if direct contact such as shaking hands, okay, followed by touching their mouth and their eyes and nose. Okay, this can occur when infected person is sneeze, cough, or near a surface. Germ can also accumulate, such as when an infected person uses a keyboard. Exhale droplets and well moisture transferred from the fingers may deposit on the keyboard surface. Then transmission can also occur when an infected person cough, sneeze into their hand. Then they touch to the surface. Okay? So transmission can also occur directly if an infected or uninfected person have a direct contact, such as shaking hands, again, followed by touching mouth and eyes and nose. Okay? So next, these are the main factors. Okay? These are the 4 main factors. Okay, first is survivability. Okay? The second one is immunity. Then the third one is disease severity. Then the fourth one is infectiousness. Okay, so 4 main factors can affect how like respiratory contact transmission risks are to occur. Okay, understanding that this can help you to reduce generally assessed transmission risk. So we will start from survivability. Okay, So when pathogen leave the body, clock start on how long they can infect another person. Okay? Although we're calling this a survival, the issue is ability to infect a few pathogens, maybe alive significantly or longer than can infect someone. So also technically occurs to some scientists, viruses are not alive at all. So survival time varies significant depending upon the pathogen and external conditions. Some can live only a minutes outside the body, but some a few hours, and other can persist days or weeks. Okay, spores formed from bacteria and fungi are highly resistant. Structural adaptation, specifically for external survivor that can last decades. Okay, so external condition also affected the survivability. The surface, the pathogen rests on can significantly affect survivability. Okay, viruses generally presents longer or hard solid surface like copper is a common exception. Okay, whereas bacteria generally remain infectious longer on most porous one. Okay. Also, humidity and elevated temperature reduce the effectivity in some pathogen, but have a little or no meaningful effect on others. For example, high humidity, it seems to reduce the influenza effectivity time, but in the 2009 swine flu viruses was not initially affected by it. So eventually, the seasonal patterns of other influenza, scientists are still determining the cause of seasonality. So the exposure to ultraviolet light like sunlight and lights and made by disinfection, inactivities mode are airborne viruses and bacteria. So the duration required depend on the pathogen and condition affecting the degree of exposure. So such a time, yearly, day or sun angle passing through the glass or clouds, etc. So okay. So now the common cause of survival time, influenza can remain airborne for up to 72 hours on surface. Okay. According to some study, but usually shorter on other contact surface. Common colds can also remain infectious for 24 hours on hard, okay, or non-porous surface. COVID-19, some studies have found also to be viable for a week or some surface, which 3 hours to 5 days being most commonly accepted range. Measles, airborne droplets can be infectious up to 2 hours according to the U.S. Center for Disease Control. So contact transmission usually required a longer survival time than respiratory transmission. So therefore, it may take millions of viruses at the start of a contact transmission path. So, but only 1,000 for a respiratory path. Next, the second one is immunity. Say, when you say immunity, this is the risk of transmitting a pathogen. Also, it depends upon how easily other people become infected. Okay, several factors affected this. Okay, first is the vaccine. Okay, make people completely immune or partially immune. Disease is less severe or contracted to a specific pathogen. And also how long the immunity will last varies depending upon the pathogen. Some like or for measles remain effective for decades, where areas like for influenza are substantially less effective with a maximum effectiveness lasting only a month. Okay, so different types of vaccine stimulate or attempt to stimulate immunity differently. So the same disease may have more than one vaccine available, or the recommended vaccine may change over the time. So vaccine use sometimes vary regionally, with some countries using a vaccine and others not. So depending upon the risk benefits analysis, okay, of local health official. And also the individual susceptibility varies. People who have disease and recovered are essentially vaccinated. So this how immune system and for how long is a similar vaccination. So individual may also vary in how strongly their immune system and respond to vaccination. Also, elderly people and those with a compromised immune system. Okay, so herd immunity occurs also when enough people have recovered from a pathogen and or been vaccinated, and the diseases cannot transfer easily. When herd immunity is present, okay, the risk of transmission decrease significantly, even for those without immunity. So next is disease severity. So this is how severe a disease is affected the transmission in two ways. Okay, so first, a severe disease usually from a strong countermeasure such as those applied to COVID-19, dropping the transmission rate. So the second one is relatively benign disease like common colds, often remain high transmissible because this disease does not warrant significant intervention. So then the last one is what we call the infectiousness, okay? Communicability, okay? Some pathogen easily infect other due to the previous factors and natures of the pathogen themselves. So healthcare professional assign a number for this called ROs. When we say RO, pronounced are not. Okay, it is the estimated rate transmission expressed as the number of people one infected person will transmit the diseases to in a population. So a pathogen with high R naught, okay, spread easily and rapidly. So second is RO, okay, it is affected by how infectious the pathogen, okay. Is the proportion of people who can get and how fast infected people to recover or die. So example of the R naught, okay, or RO, okay, RO, the value of for SARS was 4, COVID-19 is 5 to 6, and mumps is 10, and measles is 12 to 18. So the RE is the effective rate, which people become immune as a protective step, like those learning in this course are taken. Okay, so now we will proceed to the reducing airborne transmission. Okay, rest. Then now we understand the two basic ways pathogen move from one person to another and what affect their survivability. Okay, let's look the steps we can take to reduce the transmission, and starting with airborne transmission. So the two primary countermeasures are social distancing and face covering. Okay, so now social distancing, as you can see, it requires 1 meter to 2 meters in feet, 2 to 3 to 3 feet to 6 feet. Okay, common. So other influence like covering, sneezing, okay, cough, then wind and air motion, also the confined space and outdoor. So here, reducing airborne transmission risk, let's look at reduce the risk caused by inhaling pathogens suspended in the air. There are two primary countermeasures again. So first is the social distancing, okay, and covering our face or by the use of mask, as well as other intervention. Again, social distancing is keeping people spread far enough apart and inhale or cough, sneeze, droplet are not likely to reach another person in significant amounts. So opinion vary on what is distance should be. So again, we did 1 meter, okay, 1 to 2 meters in feet is 3 to 6 feet being the most common practice. And several factors affected social distancing risk reduction. Okay, again, by covering while covering sneeze, okay, and cough with a tissue, okay. When you are coughing, cover your mouth with a clean tissue, okay. reduce the droplet release into the air, okay, failing to do so. However, again, propel droplets much farther than 2 meters or 6 feet. And also, wind and air motion, okay, can carry droplets toward away, okay, from people. So confined space also with a little ventilation can accumulate easily airborne droplets in a particle and increase risk. Okay. Then being outdoors tend to delete the carry away pathogen, reduce risk to the some remains, especially if close to an infected person for unintended of period of time. Okay. So again, social distancing, business office and other public access recommendation. Again, one of the most important and obvious form of social distancing is infected people to stay away from others to avoid the transmission. Okay, so okay, let's proceed to face covering. Okay, face covering, of course, where the use of mask and face shield. Okay, so cloth, mask, bandana, face covering, filtered PPE mask, face shield, goggles, face covering requirements vary. Okay, so mask and face covering reduce the risk in different ways. Okay, it's depending upon the mask and face covering combined with the social distancing measure. So proper use of mask and face covering can significantly reduce the transmission risk. So the degree of reduction depends of the type of circumstances, okay, and still being studied. So widely, use of cloth mask, bandana, face covering is primary to protect other near the wearer. So it does this by reducing release airborne droplets, which is particularly important with pathogen like COVID-19. So that makes individual infectious before they feel symptoms. So they offer some but not significant protection for a wearer that is standard medical surgical mask. It fits to this category. So filtering or PPE mask, reusable and disposable respirator. Okay, it protects the wearer by filtering the particles when they inhale the air. Okay, so sometimes I'll also reduce the risk for those near the wearer if inhale air. So it also goes through the filter. The mask does not have a inhalation valve. So they are used by healthcare professional and other industry. If your business or workplace requires such as a mask, you are likely aware of the requirements of part of employee training. Like filtration rate, like N95, N99, and N100, the number of representing the percent of particle that filter out. So different region may have a different codings or designation to identify this. A combination of a filter and a face piece like FFP3 is a common designation. It is used a hospital or a medical environment. Also, they are also rated for how resistant that the oil, which is the most, which is the important to some work environment. So, with respect to airborne pathogen risk, so this type of mask is the most important and exposed when exposed to people with known or suspected infection diseases, and when social distancing can't be maintained. So during pandemic, such as example with COVID-19 pandemic, so specialized medical grade, specialized medical grade equipments like respirator are short supply, so they're used by general public in less necessary. So CDC or Communicable Disease Center or other source of discouragement public uses of this maintain and supply to healthcare workers. So when locally official specify that the general public should wear face covering when they are in public, okay, usually main surgical mask and cloth face covering, and rather than those needed by the healthcare worker. So Again, face shield again is reduce the wearer risk of inhaling droplets as well as reducing eye contact with droplets and as well at the hands. Okay, so they are commonly used with PPE mask by a medical professional like the goggles. It helps to reduce the eye exposure, but they must seal against the face. So glasses, contact lenses do not offer a lot of protection, but the glasses may offer some benefits. So while glasses don't offer much protection from the airborne droplets, so they do reduce touching the eyes by putting a physical barrier there. So which is advantage. So because the contact lens wearer tend to touch their eyes frequently. So the glasses may be a better option to reduce the tendency of transmission. So during pandemic or epidemic, so face covering is required may vary. At your workplace may have a specific requirement as well. So most medical PPE mask and or their filter are single use or limited use. So it's very important to follow the manufacturer's guidelines as always. Okay. Then cloth and mask and face covering should be washed regularly, or if disposable, you need to dispose it. Disinfect face shield, goggles according to manufacturer guidelines. So it's very important also to have extra mask ready to go on in case a mask fail or damage. So someone neglect to bring one. Okay. So post sign about face covering and social distancing. It's a requirement to entrance area. Also, we'll go over donning and removing mask shortly. Explain also the face covering requirements and apply to others. Okay. So as you can see, there are two other measure, which first is HEPA filtration. Then the second one is UVC light. Okay. HEPA filtration or high efficiency particulated air filtration. HEPA filtration is also known to remove the particle from the air. So tests have found associated microbes in HEPA filter. So we can infer some protective effect unless the building is a ventilation system into hospital standard. So however, HEPA filtration isn't likely to significant benefit risk reduction. The typically workplace or home to the would be not be affected to have any drawbacks. Okay. So again, the second one is UV light. Okay. So UV light also filtered out natural sunlight, but the atmosphere like sunlight. So UV light kills deactivate pathogens so in their air and on the surface also. As with HEPA, however, effectiveness is limited if not applied in hospital-like manners. UVC also can be also harm to the eyes and skin. So it must be used carefully, follow the safety requirements specified by the manufacturer. Okay. So workshop 1. So first, we will talk about reducing the contact transmission risk. Okay. So here we will identify the reduce regarding how to reduce the contact transmission risk. Okay. So reducing contact transmission, pathogen is picked up from surface, so as a result of direct contact with the infected person and enter to body mainly through the mouth, eyes, or nose. So contact transmission is risk reduction is based on breaking this chain of transmission. So the two primary methods are washing your hands, okay, coupled with not touching the eyes, okay, and disinfecting contact surfaces. So now first let's talk about hand washing. So hand washing is frequently hand washing are and avoiding touch your face is the most effective and important way to reduce the contact transmission risk. Okay, so again, several times daily, after touching a frequent contact surface, okay, after touching a surface touched by a known or suspected infected person, um, before touching your faces or any reason, before preparing food and before eating, after using the toilet and after sneezing or cough, before entering the new area. Okay, all, don't forget to do hand washing always. So again, frequent hand washing and it's avoiding touching your face is the most effective way and important way to reduce the contact transmission risk. So, first, let's talk about human skin is generally anti-pathogenic. So, one of the on most but not all skin surface, most pathogen don't survive very long. At they include the hands, however, they survive long enough to transfer to another surface where they can survive longer. Also, to enter the body, if you touch your eyes, nose, mouth, or some pathogen can also enter through a wound. So, frequent washing your hands remove pathogen, reducing the risk of transferring them, to another surface or becoming infected. If you touch the surface, make sure which happen oftenly without thinking. So make sure you need to wash your hands properly. Okay. So several times during the day, even if you think you are touched an infected surface, after touching the surface frequently, contact by others or that have been contacted also by a known or suspected in person infected person. So before touching your face for any reason, again, preparing food, you need to wash your hands properly. Okay? So now let's talk about hand sanitizer. So hand sanitizer is useful also, but option when you cannot wash your hands. Okay? However, it is important to use the correct hand sanitizer for the pathogen causing risk. So again, always remember that not all sanitizer kill all pathogen. For example, COVID-19, there are some recommendation in hand sanitizer with at least 60% ethanol or 70% isopropyl alcohol. So however, some norovirus and bacteria tolerate alcohol and hand sanitizer is ineffective or less effective. So again, hand sanitizer may not work effectively if your hands are significantly dirty. So be sure to sanitize both and whole hands. Okay, so be cautious around the heat, fire source when using alcohol. Okay, because sanitizer they are flammable, so you need to be careful in using it. So hand washing is superior because it removes the pathogen where areas hand sanitizer attempt to kill it, so which isn't always successful. However, when you can't wash your hands using a pathogen appropriate hand sanitizer, it's the next best, so in an alternative way. Okay, so it's very important sa appropriate for a group to provide okay, so next we will now discuss the proper hand washing. So as you can see, we have 8 steps on how to do the proper hand washing. First, it's very important. You need to wet your hands under the running water. Then the next one, you need to apply soap and rub your palm together. Then you need to spread the soap and lather over the back of the hands and make sure soap get in between of your finger. Then grip the grip fingers on each hand. Okay. Then make sure to clean the thumb. Okay. Then press the fingertip. Okay, of each hand. Then after that, dry thoroughly with a clean towel or paper towel. Okay. So Now let's talk about regarding the disinfectants. Okay, so uh, regular surface disinfection is very important to avoid transmission diseases. Okay, choose the disinfectant based on pathogen and surface, and also common disinfectant information you can find at the presentation below. So again, the second primary method for reducing contact transmission is to regularly disinfect your surfaces or the area. Okay, so you must choose an appropriate disinfectant based upon the pathogen and surface. Okay, some disinfectants are not effective against the certain pathogen or have not been shown to be. So, and some may damage particular material. So, when choosing disinfectant is very important beside the pathogen and surface. Okay, consider how you prepare, use, and dispose of them. So for the most pathogen, there are usually a dozen to choose from. So, but usually only need one or two to meet your requirements. So required disinfectant or sanitizer in some instance may be specialized for a certain use. For example, in most area, food services have some specific requirements based on managing pathogen risk with a disinfectant or sanitizer that they don't pose a risk of poisoning the food. So there are usually pre-established speak to your employer or for more information about what are the requirements needed. So the local regulation may affect what disinfectant are available in your area. So again, discuss locally available disinfectant and appropriate on what is the appropriate for to be used. Okay. So next, contact awareness. Okay. So contact awareness assume any surface potential transmission source. Okay. Replace contact etiquette with a gesture verbal etiquette. So again, survival time. So if you must touch, again, you need to wear gloves. Don't touch your face or anything else after you can touch your face or eyes or nose after washing. Okay, so UVC light. Again, generally, it helps to be contact aware and assume that any surface someone touch is a potential transmission source. So either being infected or picking up the pathogen by touch and behave accordingly. So think about it. Reducing and transfer is an example of returning to your automobile after being out. So sanitize your hands before taking out the key, okay, opening the door and entering it. This reduces the risk of transferring pathogen to the steering wheel and other control surfaces to use. So during epidemics and pandemics, replace contact etiquette like hug and shake hands with bows, friendly gesture, and verbal. So verbal tongue. So this your hands off or your face, especially your eyes, nose, and mouth. This can be a hard habit to break, but the mask and goggles face shield can help to protect you from the transmission diseases. So be aware of telephones, especially your cell phone. If you take a call with unclean hands, the phone needs to be disinfected. So because you may have a transfer pathogen on it. So this commonly done with appropriate disinfectant wipes or solution with approved cloth or cloth material. Okay. So most manufacturer have a recommendation or phone disinfection on their website. So you can check also the recommendation because they are using the wrong disinfectant. Maybe it can damage your devices. Okay, so if you can't disinfect a surface, applying survival times may help. For example, a large of cardboard crate may be difficult and time-consuming to disinfectant. But if you can be left undisturbed, so for 48 hours, especially where sunlight can fall it, based on estimated survival time, the risk of COVID-19 transfer would be very low. So in some circumstances, you may have to touch the surface without disinfecting them first. So one option is to use the protective barrier or gloves, and then dispose it properly. So if you use gloves, remember that they transfer pathogen just like your hands do also. So after touching something wearing them, don't touch your face or anything you don't plan to disinfect. Okay? So we'll go over proper gloves, use a bit. Okay? Another option with many but not all pathogens. So to do what you need to do is don't touch your face again. Okay? Wearing a facial can help, or anything else that thoroughly wash your hands. Okay? So next, now we will talk about the using of disinfectant. So the proper disinfection use is very important for effective disinfection and also to avoid hazard to yourself. Okay? So now using disinfectant, okay, is disinfectant use consideration. It's very important to follow all manufacturers and local instruction. Never mix disinfectant because it can be hazardous. Okay? Apply as direct, no time requirements. Okay? So again, using disinfectant is always begin by thoroughly reading the manufacturer instruction. So and be prepared to follow them completely. So this includes safety precaution. Again, wear heavy duty rubber gloves again to protect your arms. Okay, and eye protection when using a mixing disinfectant. So it must be mixed, do so in a well ventilated area. Some disinfectant may also only be used as a well ventilated area. Okay, again, never mix the disinfectant because this cause a reaction that release toxic gases. So this is especially true with chlorine, bleach, and product that contains on it. Again, apply this disinfectant as a direct by manufacturer. Again, this can include spraying, wiping, immersing a surface. Note that there are usually time requirements. The surface must keep wet with the disinfectant or immerse it on it. So for the minimum time to meet disinfection requirements, okay? Excuse. Note that disinfectant often require a reasonably clean surface. So you need to remove dirt prior to disinfecting. So it is common in your business or workplace on your you may be able to choose a disinfectant area, also a cleaner. So if you must clean before disinfecting, you need to be sure that the cleaner is completely removed to avoid reaction the disinfectant. Cool. Now, disinfectant that you must mix usually be used within a given period. So it can be stored. It is important to store in according to manufacturer's direction. So this means the remain of effectivity of the chemical. So after use, it's very important to dispose the disinfectant according to local and manufacturer guidelines. So what and when to disinfect? Okay, what and when to disinfect? So again, first, it's a high contact surface frequently, lower contact surface regularly, to make as easy as quick as possible. So again, disinfectant in high contact surface frequently, several times or daily more. These are surface that many people touch repeatedly. So such as handles, okay, of any type, light switches, toilets, keyboards, touchpads, and countertop. Okay, so most of these are obvious by watching people moving through a workplace or businesses. Will usually identify any you don't think it of. So break rooms and restroom are usually very high of contact areas. So other lower contact surface should be disinfected regularly, usually at least daily or twice daily. Example, opening and closing. So this may include the surface that highly contacted by other person but usually have a little or no contact by others, such as individual computer workstation, as a as a required for your business or work area. So take a step to make a disinfection as easily and quick as possible so it gets done properly and regularly. Example, the keyboard and the keypad on your computer shop. So touchpad are time consuming and difficult to disinfect. So usually easily to disinfect translucent keyboard cover on them. So again, example, plexiglass, sneeze barrier, need to be disinfected regularly. So just spray cleaner disinfectant that can be stored in spray bottle and does not have to be mixed by each time. So example, use appropriate pre-moistured wipes or servers like countertops, okay? Example, have a station or disinfectant gloves and eye protection, etc. near where they will be used to reduce the hassle of deploying and using them. So again, next, we will having a procedure and list. Very important. So list our disinfectant method and time. So have a procedure list for a regular disinfection and cleaning. So it's very important. Why? Because first, list its area for disinfectant to use a method and the time daily. So it may help to be specific. For example, instead of listing door handles, list break room or door handles and restroom handles. So mainly enter handles, okay? etc. You need to assign a specific individual to be responsible for each area. And for preparing, replacing, discarding disinfectant as appropriate. So when several people are responsible, it is useful to have parties check off and assign. Okay? Disinfection duties at the time as they are completed. So many workplace and business, it makes sense to thoroughly disinfect and clean at their beginning and the end of each day. So this can be have own checklist as well and include a consideration like ventilation, social distancing, markers, etc. So in many years, in many areas, okay, sorry, workplace regulation may require to have such a checklist, okay, may require that you document this use, okay. You may be required also document any incident related to an infected or suspected person being discovered and present in workplace. So again, if a person suspected of having pathogen has been in a workplace or a business, all surface should be thoroughly disinfected, okay, to avoid the transmission. But it depends upon the pathogen and circumstances. There may be local requirements related to this, okay? So now we will proceed to workshop number 3, okay? So use of personal protective equipment or PPE or masks and gloves, okay? So now we will talk about masks. Again, whereas manufacturer specify. So cover the mouth and nose and filtering mask must fit tightly, okay? Cloth medical surgical mask may fit more loosely but snug is better. So again, use of personal protective equipment or what we call PPE, mask and gloves. So mask, wear mask and face covering properly as specified by manufacturer. So all masks must cover the mouth and nose, leaving either exposed defeat the purpose of wearing it. So filtering mask, respirator must fit tightly to the so that the air goes only to the filter, okay, without entering or exhaling around the edges of facial hair can be issue in accomplishing this, okay. Excuse. So cloth medical surgical mask may be fit or loosely because their primary job is to catch moisture. It leaves your nose and mouth. That said, the best is most of their travels through the mask. Okay? So next, we will talk about mask donning. Excuse. Again, when we are doing mask donning, we need to wash and wash our hand before holding the air lobes. Then the second one, we need to inspect, then place via the air lobes. Then confirm metal band, okay, like this, and present to your nose. Then 4, band string straps mask, place over crown and base of your skull. Then 5, you need to confirm the proper seal, then avoid touching it again. So this is the procedure in mask donning. Okay? So next is a mask removal. Okay? First, before we are removing our mask, make sure you need to wash your hands thoroughly. Okay? The next is you need to grasp the air band or air loops. Again, do not touch your faces. Discard it appropriately without touching the mask. If reusable, wash and maintain according to the manufacturer order or guidelines. Again, wash your hands. Okay? It's very important. So, this is the procedure in mask removal. Then, in gloves removal, it's very important. First, to keep mask and eye protection on. Okay? Pinch and grab the near cuff and turn it inside. Okay? And out into still gloves on hand. So, hold to remove the gloves. Okay? Put ang glove finger in the second gloves and inside out. So, for discarded properly, okay, if you accidentally touch the gloves interior, you need to wash and sanitize your hands. A good extra precaution in any case to avoid transmission diseases. Okay, so now let's talk about the workshop number 4. So it's very important managing a medical emergency. So when managing a medical emergency during an epidemic or pandemic, reducing disease transmission risk in a medical emergency is a concern because rendering aid often means making direct patient contact. So how this affect care can vary with pathogen. Okay, so stay informed about a specific recommendation for a particular pandemic or epidemic. So again, recommendation for lay rescuer during a COVID-19 pandemic. Okay, so where available barrier. Okay, compression may cause airborne droplets. Then assess responsive and breathing by shaking the patient. You don't need to open the airway. Okay, do not put your face at the near patient. Okay, contact the EMS if alone. Use speaker mode so you remain contact with the EMS. Excuse me. So because based on ILCOR, again, when we say ILCOR, it is International Liaison Committee on Resuscitation. So the guidelines for COVID-19 or on other resources here are recommendation regarding the primary care or CPR or also known cardiopulmonary resuscitation. So by lay rescue of the patient, known or possible COVID-19 infection, again, it's very important to wear the most effective facial protection or gloves and other barriers available. Again, ILCOR thinks compression may not certain caused by the patient expel the airborne droplets. Now, when you are assessing the responsiveness of the patient, when you are assessing the responsiveness and breathing by shaking the patient, look for breathing but do not open the airway because when you open the airway, it will create maybe there are some saliva or aerosol of the patient. It will create a transmission to you. So do not put your face near the patient to listen. It's very important have some contact EMS. If you do it alone, okay, put on the speaker mode so you can remain contact with EMS while
performing defibrillation or CPR. Okay? Next, if suspected cardiac arrest, okay? So, your patient, if cardiac arrest, you already suspected, an AED is available. Use IAD if CPR must be performed. Use compression only CPR, okay? Rescue breath for infant and children are still recommended if lay rescuer are willing, okay? Also, train are able to give them, okay? So place a loose cloth, okay, or cloth mask or a surgical mask or something similar to cover the patient mouth and nose before a compression or defibrillation attempt, because this may reduce the risk of airborne particles expelled by the patient. So defibrillation may have less risk of causing airborne particles. So for unknown COVID-19 status with no sign and symptoms or a non-isolated responder may perform primary and secondary care if able and willing without modification. So, a non-isolated responder is someone who already living in a close social contact with the patient, such as a spouse, a parent, or child, or most cardiac arrests occur at home, okay, making this a reasonable possibility. So, because the patient is non-isolated, responder are already exposed to each other, any additional risk of disease transmission is likely to be low. So, in other words, it is likely either they are both already have it or they both don't have it. Okay, so this does not necessarily apply to pathogen or other COVID-19, and even if the non-responder and patient are not socially isolated. So, it is one known to be highly suspected of being infected, and other is not like a previous COVID-19 recommendation and are advocated. Okay? So, next, handling a medical emergency. So, this cause interrupt to normal transmission reduction measure. Again, after handling the emergency, okay, and turning the patient over to emergency medical care, always remember to wash your hands properly or use a sanitizer if unable to do so. So, again, disinfect the surfaces, okay, contact the local health authorities, and it's very important to report the required by local regulation. So, again, contact the local health authorities for testing and screening for exposure to the pathogens, such as reporting the following medical emergency to them may be required by local regulation. So, next is it's recommended that in your business or workplace to have more pathogen protection kit. So with or near first aid or ED equipment. Okay. So the idea is to include medical mask. Okay. Ideally N99, or if you have N100 if available. Also it's very important to have at your first aid kit the gloves and hand sanitizer, so they are readily available in case of emergency, and also especially located to reduce the time required to provide rescuer protection. So it's very important to check the kit regularly to be sure that they remain stocked. Okay, to check the expiration date, so to remove the expired items on your first aid kit and replace them with new one, and to replace the disinfectant and sanitizer and mask other barriers before reaching the manufacturer expiration date. Okay, so again, workshop number 5, information source. Again, information source of this topic during epidemic and pandemic, the healthcare associated with them tend to rapidly evolving events. It is important to keep up with changes in a recommended procedure for the risk of reduction, as well required practice record keeping and reports. excuse me. So locally and national and regionally governments authority usually have a website that are keep updated. So when epidemic or pandemic in progress, so you can check their website for any update. Okay. So as you can see, primary global information source. You can also visit the website of Center for Disease Control and Prevention, or CDC, and also the World Health Organization, or WHO. Both organizations, they are monitoring the global pandemic and regional epidemics. So learn more about emergency care is very important. CPR and first aid through emergency first response training. So next, okay, let's summarize our topic again. The summary of our airborne pathogen awareness. Again, when we say airborne pathogen, these are diseases that transmit from infected people via fluid existing from or entering the respiratory system. So again, airborne respiratory and contact transmission are the two primary ways they will spread. Okay, so transmission risk is influenced by pathogens, or by, remember the four main factors: survivability, the proportion of immune people in the population, how severe the disease, and how infectious is it. Okay, then again, apart from vaccination, airborne transmission is risk by reducing the use of social distancing. It's very important by wearing face covering, physical barriers, ventilation, limiting the gathering of people in small, okay, confined areas also seem to reduce risk. Next is the different types of masks to be used to reduce the risk in different ways. So the widely used cloth, masks, and medical surgical masks primarily also reduce the risk for people nearly the wearer. So filtering masks or respirators reduce the risk for the wearer and may protect those near the wearer. Okay. So apart from vaccination, so contact transmission is reduced by frequently hand washing and sanitizing. Again, not touching the face and disinfecting contact surfaces frequently. And it's very important, always remember, do the frequent hand washing. It is one of the most effective steps to avoid the transmission diseases. Again, always remember, disinfectant must be chosen based on the pathogens, okay, and where and how it will be used. Remember, always read the manufacturer instruction, must be followed. Again, never mix the disinfectant and wear eye and hand protection when mixing or using as advised by the manufacturer. Okay, so again, disinfectant is high contact. Disinfect the high contact surfaces frequently. Okay, have a plan and procedure for regularly disinfecting the workplace. It's very important also to follow always the proper procedure by done and removing masks and gloves properly. Make sure they fit according to your manufacturer guidelines. So always remember to dispose them properly. Okay. So again, during pandemic, epidemic, recommendation for emergency healthcare like CPR or cardiopulmonary resuscitation may change. Example, for lay person helping an unresponsive patient during the COVID-19 pandemic, the recommendation including wearing available protective devices, especially not opening the airway, again, watching for breathing but not getting near to the patient face. Again, using AED if available, okay? Using a compression only CPR and covering the patient mouth and nose with a cloth before AED shock or compression. Again, keeping a pathogen protection kit with other emergency supplies is also recommended. Again, epidemic and pandemic evolve rapidly, so stay updated about changing local practice and requirement. You can also always check for any updates again for the website of CDC and WHO. So you can check their website for any updates and new guidelines, especially when we're doing our helping in a public places, especially in medical emergencies. So uh, this is the end of our topic. So any question at all? Okay guys, I will send it the evaluation via your messenger. Okay? So thank you and good night.